Hafa Day and welcome. Welcome to the Honorable Lourdes A. Leon Guerrero, Governor of Guam, Magahagan Guahan. Thank you to everybody who's joining us today for this press conference. We're here today for the official launch of the Guam COVID Alert app. It's a contact tracing app that has the ability to alert app users if they've been exposed to other users who've been diagnosed with COVID-19. Our team of developers, volunteers, beta testers, and outreach have been working hard to bring you the Guam COVID Alert app, all in the name of containing the spread of COVID-19. Today, we'll be showing you a demo of how the app works, but before we get to that, I'd like to introduce to you our panel members. Of course, we have the Honorable Lourdes A. Leon Guerrero, Governor of Guam. Also with us today is Joshua F. Tenorio, Lieutenant Governor of Guam, Segunda Galahan Guam. We also have Arthur St. Augustine, Acting Director of the Department of Public Health and Social Services. Also with us today is Frank Lujan, Chief Technology Officer with the Office of Technology. Dr. Ramesh Raskar, Associate Professor of MIT Lab and founder of PathCheck Foundation. Jeff Kushmerek, Head of Professional Services with PathCheck. We also have Vince Munoz, Managing Member of NextGen Sys and developer with PathCheck. Ms. Shante Benitez, Infinity Web and developer with PathCheck. And Ms. Maya Guzman with Galeti Group. And now I'd like to invite Governor Leon Guerrero to give some remarks.
Thank you very much, Janilla. Hafa Day to you and also our panel members. In less than 1 month, we have lost 16 souls to this virus. Over 70% of our total cases were confirmed in August and September alone. Over 50 COVID patients are hospitalized at GMH, and 12 of them are on ventilators. COVID-19 doesn't just affect the sick and the elderly, it's infecting the young, the active, the otherwise healthy. It can affect your neighbors, your coworkers, your friends, your family, and even you. We are seeing people being admitted quicker than they were in the beginning of this pandemic. This is because while the rate of COVID spread has plateaued to our declaration of PCOR 1, it has not yet begun to decline at the rate necessary to allow our healthcare system to fully recover. And we've noticed they are sicker too. If our numbers don't change, I'm afraid we will reach a point where our hospital is so full of COVID patients that we may not have room to treat any other ailment. And doctors may be forced to choose who should be treated because we lack the resources to do so. To prevent this from happening on our island, I will be extending the stay-at-home order for another week until noon on September 18. Guam remains in PCOR 1, and there are no changes in these restrictions. We need whatever tools we can get to fight this virus. Today, I am excited to announce the launch of the Guam COVID Alert app. This app uses smartphones, Bluetooth, wireless signals to figure out when you've been in contact with someone who tested positive for COVID-19. This app is completely voluntary and, most importantly, completely anonymous. It does not collect your information, nor does it track your location. You don't even need to interact with it much. The only time you'd use the app would be to report yourself as positive or if you receive a notification that you may have been exposed. If it's so simple, you might be wondering, what's the catch? The catch is this. In order for it to be successful, we need a lot of people to use it. According to researchers at Oxford University, for every 100 to 200 downloads of the app, it can prevent 100 infections and save 1 life. I encourage all of you to download this app. Encourage your employees, your family, your friends, everyone you know to add their phones on the fight against COVID-19. Our doctors, our nurses, and our contact tracers and our investigators have worked tirelessly since the beginning of this pandemic to keep our island safe, and they need our help. And you can do that with a simple download. Thank you, and see you soon.
Thank you, Governor. And now I'd like to invite the Lieutenant Governor, Josh Tenorio, to make a few remarks.
Thank you, Janella. Hafaday, I want to first thank the people of Guam for their patience and understanding during the most challenging time facing our island and the entire world since World War II. The people of Guam have recovered and thrived after every disaster imaginable. A brutal war occupation, earthquakes, typhoons, and yes, even the prior pandemic 100 years ago. And we will all do it again. When I got the call telling me I was positive for COVID-19, I didn't think of myself at first. I thought of my mother, my partner, my sister, my nephews, my colleagues, staff, and everyone I could have possibly exposed. You start thinking about what may have gone wrong. How did I fail to protect myself and others when I had been taking all the recommended precautions? But the fact is that COVID-19 is very contagious. COVID-19 is certainly not the flu, and it impacts people very differently. Some people do have flu symptoms, and others have better circumstances or genetics and are fortunately asymptomatic. But for others, this experience can be life-threatening. And we must remember that 21 of our own residents have been lost to COVID. For me, I had a fever for 9 days straight, the worst fatigue and despair I had ever experienced. And while I'm thankful I did not get hospitalized, there are many who are not as fortunate, including the 56 people that are currently hospitalized on our island. As the number of cases rises, the number of people that need to be contacted rises as well. Our contact tracers need help. And that's why tools like Guam COVID Alert can be very valuable. But in order for the app to be successful and effective, we need a significant number of our residents to buy in and volunteer to use the app. Our efforts will be most effective if 60% of our population downloads and uses the app. As of this date, no jurisdiction has achieved anything above 38%. I know we can do better than that. This app isn't a magic bullet. It won't replace what we know works: staying home, social distancing, and wearing masks. But as the governor said, we need whatever tools we can get to win against COVID-19. Thank you.
Thank you, Lieutenant Governor. And now to call on Public Health Director Art San Agustin for his remarks.
Thank you, Janella. Governor, Lieutenant Governor. First of all, I'd like to thank my team at Public Health and Social Services, Janella herself, who's hosting this, Grace, Vivian, and Sean, Dr. Thane Hancock, who's our CDC advisor, and who worked on the application in terms of its local aspect, as well as Chima and Annette. So thank you all for being a part of this launch and being a part of the development and the marketing aspect, and also to all the partners that have come on board. Thank you so much. Well, we know there is no silver bullet to eliminate COVID-19 from Guam. This app, I feel, will be another weapon that everyone in Guam can use to fight COVID-19 together. It doesn't replace the hard work our case investigators and contact tracers do at Public Health. But what Guam COVID Alert does bring is additional power of contact tracing to help you stop the spread of COVID-19 on Guam. I ask all of us, as the Lieutenant Governor has put a challenge, let's rise above that 38%. Let's hit that 60% mark. And as the governor has also indicated, let's join our resources and our efforts to stop this. And so with that, I ask that we all consider, and I encourage all to download the app. It will let you know if you're in proximity to someone who had COVID-19 and what action you should take to stop any further spread of the virus. All of this, as the governor has stated, is done anonymously. but it does give you an alert that you were recently in proximity to someone with COVID-19. You can start to carefully monitor yourself for symptoms of COVID-19 and arrange for testing if you develop symptoms. Most importantly, you can also take action to make sure you do not spread it to anyone else. For the 14 days after receiving an alert, you should avoid going to areas with other people, refrain from visiting friends and family members, and try to separate yourself from others in your home. Taking these quick actions to protect others will break the transmission of chain of COVID-19 on Guam. Again, as we all know, this app is very anonymous, it's extremely anonymous. It doesn't even share information about public health. So we will continue our standard practice in terms of standard systems for disease reporting and contact tracing in addition to this app. Thank you very much. And again, as the Governor, Lieutenant Governor has stated, we are in support of this app. It's another tool in our arsenal to combat COVID-19 on Guam. And we ask all our family and our friends to join in the fight and sign up for COVID-19, Guam COVID-19 alert. Thank you.
Thank you, Director San Agustin. I now I'd like to ask Dr. Ramesh to come on board, make his remarks. He's a very special guest. We're honored to have him join us today. Dr. Ramesh is the founder, Dr. Raskar, he's founder of PathCheck Foundation, the world's largest nonprofit privacy preserving open source market for COVID-19. PathCheck Foundation is made up of over 1,000 volunteers who've spent countless hours developing exposure notification technology. You might also recognize him for his role at MIT for his conventions, such as the camera to see around corners, femtophotography, automated machine learning, a novel CAT scan machine, and numerous other inventions. Welcome, Dr. Ramesh.
Thank you, and what an honor and what a great day for Guam in the middle of this big challenge with COVID-19 in a beautiful, beautiful territory of Guam. I really want to congratulate Guam for, first of all, having the foresight to be the very early partner and be the very first US territory to launch the app. And even among states, only about 6 other states. So it's really wonderful to see Guam taking the lead in technology and public health to launch this. And also want to thank our partners from Guam, Vince Munoz and Frank Lohan and Shante Benitez, who have been spending many hours contributing not just to the Guam app, but for the app that will be used by the rest of the world as well. And as I said, Janela, PathCheck is really, world's largest nonprofit health response solutions. And just as Guam has been very innovative in getting started, and as we consider its impact on tourism and cruise ships and hotels and getting back to work, I hope Guam will be the shining light of innovation in Pacific region to combat COVID-19. So at PathCheck, we're committed to digital pandemic response, and that goes beyond just the exposure notification, which is a step 1. But as we get into testing and vaccines and getting people back to work in a privacy-preserving way, we hope to continue to work with Guam when it comes to many areas of tourism and hotels and restaurants and many functions on the island. And of course, in addition to thousands of volunteers who have been participating in this effort, I also want to recognize our CEO, Adam Berry, our CTO, Sam Zimmerman, and many of our partners who are here on the call, such as Jeff Kushmarek, Mary Catherine McCurry, Francesco Khalil, and a very large outreach team. It's a proud moment, but our work is just getting started. So I'm looking forward to a partnership with Guam, and congratulations on the app.
Thank you very much, Dr. Ramesh. Now we'll proceed to the demonstration of the Guam COVID Alert app. But before we do that, I'd like to ask Vince Munoz to just give us a brief explanation of the hows and whys of the COVID Alert app. Vince is an accomplished software executive with over 30 years of experience in software in the software industry, and has a degree in engineering from the University of California. He received his PMBA from the University of Guam, and he's a Director's Fellow with the UOG Regional Center for Public Policy.
Hello, can you hear me? Okay. Thank you for that, Janella. So good morning, everyone. You know, a renowned research study conducted by Oxford University found that digital contact tracing can reduce the spread of the COVID-19 virus. The Oxford study simulated the impact of the spread of the virus when digital contact tracing is used or not used. Researchers studied different percentage population adoption rates of digital contact tracing and their impact on preventing or reducing the spread of the COVID-19 virus. The Oxford study chart that you see illustrates that the more people who adopt or download a digital contact tracing app, the greater the reduction in the number of new cases and deaths over time. As you can see, that yellow line at the bottom of the chart illustrates the number of infections that occur over 150 days when an adoption rate of 56% of the population is achieved. Whereas the purple line at the top of the chart shows a substantially higher number of infections estimated when no digital contact tracing app is used. So the Oxford study estimated, as the governor had said earlier, that for every 100 to 200 downloads of a digital contact tracing app, this could save one life and prevent 100 infections. Next slide, please. So there are 5 key points of the Oxford study that we wanted to discuss. You know, the study illustrated that almost half of the transmissions occurred before anyone showed symptoms of infection. The second point was it showed that manual contact tracing would be hard pressed to contain the spread of the virus because, you know, a contact tracer, you know, basically they interview a person and that has tested positive and gather information about the name or identity of people that they've come into contact and ask those people to go in quarantine. But what is difficult for them to identify are people in a market that they may have gone to, or a restaurant or a gathering place. And this is what makes it difficult for contact tracers to be able to identify these people. The third point is that, as we stated, the higher the adoption rates of digital contact tracing, the greater reduction in new cases and deaths. And the fourth point that we wanted to discuss was, with the adoption of digital contact tracing, we can minimize our lockdowns, which is important in a non-immune population. It requires that the isolation of non-symptomatic infected individuals take place. With an app, we can target potentially infected people and notify them of their exposure, which is a managed quarantine. That quarantine reduces the spread and preserves an epidemic level of control. That can safeguard against the need for lockdowns. You know, by adopting a digital contact tracing app, we can target recommendations which can be extremely critical in situations where testing kits are short in supply or our medical facilities are overburdened. And this is where Dr. Kane and the CDC and the Guam Department of Health are doing this by providing a series of next steps targeted at persons who have been exposed, to include self-assessment, guidance, and you know, what it is that persons need to do and who should go and be tested. I would like to point out that the first GAIN app that was implemented was by Virginia just 4 weeks ago. So Guam will be the first territory to implement the GAIN app, as Ramesh had recently mentioned. So we want to make it clear that if the question is, why didn't we do this earlier? And the reason is because this is relatively new. And lastly, the fifth point that we wanted to make was that if Guam can achieve that 60% of the population download, then we are going to outdo every country or state in the world. To date, we don't know of anyone that has reached 38% adoption rate. And we feel like we're a community that can beat that number. We shared this with Google and we told them, I said, when we break that 38% adoption rate on Guam, you Google, you better tell our story. And they replied, yes, indeed, they will tell everyone our story. So next slide, please. So in conjunction with the Oxford study, Google also did an adoption rate study. And what Google found was the first 7 to 14 days was when the adoption of the app took place. And after that, it flattened out. What that meant is that nobody was adopting the app, but more important, that the key to success is our marketing outreach efforts in the community. In our meeting with Google, they emphasized this so much that they recommended that we not launch if our marketing and outreach plan was not ready. And Monica and Janella and the whole Guam team has been out there having multiple outreach meetings and doing everything it can to get the word out. And we began collaborating with PathCheck Foundation right early in the year. And we had worked with nonprofits and government professionals from South Africa, the Caribbean islands, Australia, Hawaii, Cyprus, and many other countries, as this is a global effort to try and keep our communities and families safe and healthy. So one of the things that I wanted to bring up is that during the outreach, we found that there are some concerns about privacy. And we wanted to make sure that everybody understood that Google, Apple, PathCheck team has made privacy protection mandatory and a non-negotiable requirement for this app. That being said, it still needs to be understood that the development of such an app required an element of trust. We've done everything humanly possible within our means to test and assess that privacy is preserved. The issue of trust, we know, is important. And we must trust each person out there that is using the app, and that our trust comes from the faith that we have that everyone at Google, Apple, and PathCheck and our government are doing their utmost best to protect our privacy and reduce the spread of COVID-19. We all wish that time to create technology that is infallible, but in a non-immune population, we have to try with what resources we have. Hopefully, easier, more accessible testing will be available, and of course, a vaccine. But in the meantime, we have to give our best effort. Thank you for the opportunity to speak with you today. I'd like to pass this back to Janella.
Thank you, Vince. Now I'll turn it over to Frank Lujan for a demonstration of the app.
Good morning, and thank you, Janella. I'm Frank Lujan, the Government of Guam's Chief Technology Officer with the Office of Technology. Thank you for this exciting opportunity to present this technology along with this committed team of passionate professionals. Most of my peers and colleagues would agree that this is an incredible opportunity to work in unprecedented times with these unprecedented technologies. The Google Apple Exposure Notifications is a project conceived by Google and Apple, together representing over 99% of all mobile operating systems around the world. This partnership has worked together over the course of 8 weeks to produce a protocol that has tremendous potential to control and fight the spread of COVID-19. Google Apple created these APIs, giving incredibly powerful access to an operating system level to allow the exchange of unique identifiers between phones that are in proximity of each other. The API, the GAIN protocol, is Bluetooth only. Google Apple placed several important restrictions on their APIs. The first is that there's only one app per jurisdiction. A jurisdiction could either be at a country level or a state level. There are also really important constraints about the sort of access to other information that a GAIN application can have. Firstly, they're not allowed to access contacts that are on your phone. Secondly, they're not allowed to access any of the location services on your phone. And then lastly, they're not allowed to access a number of protocols that could potentially hurt the privacy preserving nature of the GAIN protocol. Amazingly, Google and Apple worked together to produce this protocol that balances the constraints and needs of the public health authority with very strong privacy preserving constraints for individual users. We've been working for the past 4 months with access to these APIs to build the Guam version of the GAIN application. With the first minimum viable prototype of this framework, this MVP, if you will, is currently available to install on both Android and iOS devices. Now, in this slide, I'll briefly walk through the basic way in which the notifications work. You have Bob and you have Alice. Alice is sitting on a bench and Bob sits down next to her. Bob and Alice each have a phone. It could be an Android or an iOS. Bob and Alice their phones exchange unique identifiers with strong cryptography, making it really hard to reverse engineer on that unique identifier, therefore protecting the identities of individuals using the app. Then we imagine that Bob is diagnosed as COVID-19 positive. Bob is given a verification code about his COVID-19 status from public health. Bob can choose to submit this verification code on his mobile device that is verified by public health, establishing him as a COVID-19 positive individual. Bob is then given an opportunity to submit his keys to a global key store running on a server that public health is hosting. And then it's broadcast and shared with individuals who are actively using the app on Guam. Next slide, please. Now, Alice, she doesn't know that Bob has COVID-19 or was COVID-19 positive, but Alice's phone pulls down these unique identifier keys and matches the keys that she's been seeing over the past 14 days with the keys that Bob has uploaded. As a result of that match, that happens to be at the operating system level, Alice gets an exposure notification that pops up on her device, and then Alice is immediately plugged into a flow for next steps, tailored specifically for the public health processes. The app could ask Alice to take a self-assessment. It could also advise Alice to call public health. And now I'm going to turn over some of the details of this workflow to Shantae. Shantae?
Thank you, Frank. Half a day and good morning to everyone on the call. I'm Shantae Benitez from Infinity Web, and I was the lead in the beta testing effort for this particular app. So I worked with beta testing teams from the University of Guam, MacTech Guam, and more recently, the Department of Public Health users. And what we did before the launch of the app is test all of the features on this app and constantly send feedback to the PathTech development team who worked out of Boston and the UK. So we saw firsthand the privacy preserving features that ensures that none of your private information, identifying information is ever shared or tracked through the app. The only time you ever share anything is if you are like Bob in the previous scenario and want to submit your positive anonymous keys to an authorized public health authority. And so this slide here pretty much shows that interaction between Bob and public health, and the reason that you need a verification code from a case investigator at public health is to ensure that there are no false positives ever reported through the app as well. And I'll be showing this in the live demonstration. So on the left of my screen, you can see that I have the Guam COVID Alert app already downloaded to my phone. What I'm gonna do is open up the app, and as if I am Bob or a positive user, I'd like to submit a positive test by clicking the button at the bottom of the screen. So what that's going to do is going to prompt me to start and enter my verification code. On the right of my screen, I've prepared the interface between the case investigator at DPHSS to create this verification code by signing in with a user and password. So I've already set this at positive test. They enter the testing date and the symptoms onset date, and then they click create verification code. So this is available for 15 minutes and expires to ensure security. So Bob is going to enter this verification code, and this could be with the Department of Health over the phone or through a conference call. Once he submits this verification code, he will be prompted to share his anonymous keys and given information on what this means. So he understands and consents, and this is all voluntary. And then he's thanked for keeping his community safe. So after some time, Alice, as seen in the previous scenario, may receive an exposure notification and look at her exposure history. So she'll see that, okay, in the past 7 to 14 days, there's been a possible exposure. What should I do next? So she's gonna click the next steps button, and this will open up to a page on the Guam COVID Alert website, which was put together by Dr. Thain of the CDC and the public health team. And there are 3 simple steps. One is to take care of yourself and monitor for the signs and symptoms of COVID, whether or not you're feeling any signs or if anything is getting worse. The second step is to protect yourself and others by staying home. So stay home for the next 14 days to monitor everything that you're feeling and any symptoms. The third step is to act now and not delay in taking the steps to fighting COVID. So there are also numbers to clinics who are offering testing, and the Guam Medical Association directory, as well as other helpful links. This is a good transition into the actual Guam COVID Alert website, which is live and offers information about all of the things you need to know about the app or before downloading the app. The resources have frequently asked questions, a supporter toolkit, the fact sheet, the presentation you see today, and the privacy policy. So throughout all of this information, there are also a couple short videos that I'll play. It's just a 2-minute video for the sake of time. This video is created by Google and Apple, showing how the app works.
Battling COVID-19 is an unprecedented global challenge. To get communities around the world back up and running as quickly and safely as possible, public health authorities are building smartphone apps to help with contact tracing. Contact tracing is one of the best ways to stop a virus from spreading. It can take thousands of disease investigators to alert everyone who's been in contact with people who've tested positive. But even if disease investigators do their jobs perfectly, alerting the people a COVID patient doesn't know or can't remember is incredibly difficult. Smartphone apps that public health authorities build can help people at risk of infection get notified much more quickly. But a contact tracing app works best when more people download it. And being asked to download an app without knowing how it will handle your personal information might cause people to worry about their privacy, and they may not feel safe participating. That's why engineers at Apple and Google have been working together to make public health technology that protects individual privacy so that people never have to choose between their privacy and the health and safety of their community. You're probably wondering what that means and how that all works, and we're going to walk you through it in a second, but first let's be really clear about a couple things. First, apps using this system cannot track your location. And second, this system does not share your identity with Google, Apple, or other users. Here's how that works. For every phone that's opted in, our technology disguises your identity by generating a random sequence of numbers that change every few minutes. Then, using Bluetooth, anytime your phone detects another phone close by that's also opted in, the two exchange those random numbers. If in the future someone's positive for COVID-19, they can report that positive result in their app. Any phones that had exchanged random numbers in the last 14 days will receive a notification that they may have been exposed to COVID-19 without revealing their identity. Public health authorities can then help anyone at risk get testing and treatment. But it's up to all of us to help with contact tracing. Do your part and look for your public health authority app that uses this exposure notifications system. The more people who participate, the sooner we can beat COVID-19 and get our communities back on their feet.
So now I'm going to hand it back over to Janella.
Thank you, Shante. And now I'll turn it over to Monica Guzman to talk about community engagement and partnerships. Thank you.
Thank you, Janella. Before we go into the community engagement, just to summarize the presentations by Frank, Vince, and Shante. There are 1 to 200 installs that will save 1 life and prevent 100 infections. And critical is the 2 weeks after the launch. So we need to encourage adoption and awareness. A lot of concern on privacy issues, but if you saw earlier, Google, Apple, and PatCheck have addressed those privacy issues. We're at it's 100% voluntary participation, and like Vince alluded to, it's all about trust. Trust is paramount, that the developer team did everything they can to ensure that all those privacy issues are addressed. Trust in the app that it'll work. Trust in our governor, in our public health and healthcare system, in trying to protect our island, and trust in all of us as residents of Guam to do whatever we can to help to contain the virus, because containing the virus will get our economy back on track. So a little bit of community engagement. What I'd like to say is that we've developed an outreach plan, and like Shante said, we have the guamcovidalert.guam.gov website where we have all these assets. What you see on the screen now is a add your phone to the COVID fight graphic. There are different iterations of this graphic that are on the website in the resource tab under the supporter toolkit. We ask everyone to please feel free to use these assets to encourage everyone to download the app, because we do want to reach the threshold. We want to beat 50% and 60% as far as downloads, and we want to make sure that we protect our island. In order for this to be successful, the higher the adoption rate will assist in containing the virus. It's all about being safe, protecting our island, and helping our healthcare community to do the critical work that they are charged with. We hope we can get as many partners to sign on using all our networks. Let's all work together to win this fight against COVID-19. I'd like to thank some of our partners that have signed on so far. We've got the Contractors Association, the Guam Hotel Restaurant Association, the Guam Women's Chamber of Commerce, Guam Chamber of Commerce, Chinese Chamber of Commerce, Guam Korean Chamber of Commerce, the Guam Visitors Bureau, the Mayor's Council. We have our coalition with the Physicians Advisory Group, Guam Medical Association, Guam Medical Society, our telecom partners, GTA, IT&E, Docomo, and then of course, all of our media partners. We just want to thank them. They continue to assist the public health and the Office of the Governor to get the word out, and we want to just are very appreciative. Private partners, we have the Bank of Guam also on board, and we've got Guam Community College. We're continuing to do the outreach effort, and we hope that we'll be able to sign people on as partners. The website is guamcovidalert.guam.gov, and if you have any questions, the email is info@guamcovidalert.guam.gov. Thank you, Janella.
Thank you, Monica. Now we'll go ahead and open the floor to our Q&A portion. I'll go ahead and let me see our participants here. I'll start with Nestor Lacancho from KOAM.
Thanks, Janella. Well, thanks for the presentation. That's a lot of information to digest. I'm not sure who would respond to this, but how are you going to go about, and I think everybody mentioned this, how are you going to go about convincing maybe a skeptical community, particularly about privacy concerns, to buy into this app?
Perhaps Vince might be able to answer that question.
Yes. So, you know, one of the things about the app is that Google and Apple, for example, prohibit us from even doing any GPS location tracking when running the app. We can't take photos when running the app, and they scrutinize this app like no other app I've ever worked with. And that's because of, I would have to say, number one, because they only allow you to implement this app one per state, and in the case, one person per Guam. You couldn't have 5 companies doing the Google Apple exposure notification. So what that meant was it went through a very rigorous testing to make sure that privacy was protected. There is no information regarding your contact info that is shared. And sometimes it's difficult to understand what those anonymous keys are, but basically they're exchanging these random keys. And when those random keys are given to other people to see whether or not you've been exposed, had exchanged with that other device, you have no idea who the person is. You don't even have an idea of the time or the day, because they broke it up into sections where it was, you've been exposed in the last 3 days, which is the asymptomatic period. And then they said you could have been exposed in the last 4 to 6 days, which is the period where you should start feeling some symptoms. And then there's the period of 7 to 14 days, which if you don't feel symptoms, then, you know, maybe you're good. But what that does is it allows public health to treat people in those different sections, preserve privacy, and still be able to manage the quarantining of people. And of course, with Ramesh here, I would always ask Ramesh if he wanted to comment on anything, and if he felt that was a good enough explanation, you know, I will defer to him, of course.
Yeah, that's a great explanation about privacy. Absolutely. The protocols themselves make it very clear that the information can be used only to estimate proximity, and no information is shared with the government, even with path check or anybody else for that matter. Any personally identifiable information is not shared.
Yeah, and thank you. And Professor Raskar, and maybe even Vince. So what do we do about what they call the worried well? So we're going to have all these people out there who may be getting dings from their phones saying you may have been exposed. So I anticipate that possibly there's going to be a lot more people out there worried about having contracted the virus. So Professor Raskar, in other municipalities that have adopted this app, has there been a problem with perhaps this overwhelming their public health resources?
Yeah, I think it's an important question about the worried well, and the app as well as the website does a very good job in explaining what the next steps are, so that they don't start jamming the phone lines, and they would make a phone call only if they understand the instructions to go forward. So it has not been an issue in other countries so far, which is a good thing.
And has there been an effort, Vince, to reach out to the local telecom companies who are in constant contact with?
Yeah, Janella and them actually had worked with the telecoms to try, and Frank as well, to whitelist these areas. That means that they're not going to charge when trying to go to path check to download, to Google or Apple to download the app. We would like it if, and they're looking at the possibility of maybe even not charging at all. So even if your cellular services would drop, that you would still be able to get cellular Wi-Fi for these types of services. So that was really interesting, a really interesting conversation. One thing I wanted to get back, about those rumors, though, Nestor, is, we cannot underemphasize the need for trust in our community. If we don't trust each other and we don't make an effort to try and do something about this, then the whole point of this technology is to try and manage the quarantining. Because if we're not able to do this, then we have no choice. It's going to increase, it's going to spread, and we have no choice but to do lockdowns. So this is how we manage and avoid lockdowns. We can manage this by isolating those people that are potentially exposed to the virus.
Thank you, Nestor.
And that one.
Sorry, Nestor. And just to be fair, in the interest of time, because we're hitting an hour, I'm just going to go ahead and go to the next reporter. If you have further questions, you can go ahead and send it to me. Thank you, Nestor. Next is Jolene Tovas from PNC. Jolene, we'll go ahead and circle back to you. We'll go to Jasmine Weiss from PDN.
Thanks very much. So the code that public health gives to a positive patient, will public health just give that to everyone who gets a positive? They just get a code, or how does that work? Or will they ask them, do you have an app?
Well, that would be all based on the positive person, because they would have to agree to voluntarily join the app. So that would be something that would be between the positive and public health. And then that's when they'll get the code. We're asking that they do sign up for the app, and that would help everybody else in terms of being given the exposure notification. Thank you.
Thanks very much. And I also had a question. So we know that contact tracing helps to capture positive cases, and so does government quarantine. And public health has given exemptions to people not to go into government quarantine. Some plumbers, pharma attorneys have been exempt from the government facility quarantine. I'd like to ask the director of public health, can he just sort of explain how do you make the determination that a person should be exempt because they're a critical service worker?
Sure, absolutely. So we have different categories. We have an essential healthcare worker, and these are nurses and physicians. We also have critical services worker. Critical services workers are those individuals that are critical to Guam's operations. So for example, if someone's coming in to assist, which is actually the case with the upcoming election, to train for the use of the machines for the upcoming election, then that person would be given an exemption. However, they do need to come in with an acceptable negative COVID-19 test result, and it has to be, again, 5 days prior to arrival on Guam. And they're also placed on a restriction of movement. So they don't have free run of the island. They actually go to work, and then they go back to their residence or rental lodging. So each case is weighed and evaluated depending on what they're requesting, how long they're going to be here, and what their key function is for Guam's operation. I hope that answers your question, and let me know if I could be of any further assistance in that area. Thank you.
Thanks very much.
Thank you, Jasmine. Next is May Habib from PNC.
Hi, everyone, and thank you so much for the presentation. I'm just wondering, the purpose of this app is as a sort of way to live with COVID. This is a way that we can a plan forward? Because it seems like there's no actual plan of how we can live with COVID or get back to some sort of normalcy. Is this app meant to do that? I'm not sure who can answer that specifically, or multiple people.
Well, for public health and social services, it's a critical tool, and it's a tool that we can use because what happens is if our positives do agree to sign up on the app, what it does is it gives you an alert of exposure. And one of the concerns we have are people from our community is, oh, was I exposed? Contact tracing is behind a day or two. So this gives our community advanced notification so they can take measures for themselves to protect themselves and their families and the community. So it is a tool that can help us. Perhaps one day it may be the new normal, but I can't say with certainty at this point. But definitely it is a tool that would help our community and also those who are worried. Well, they're like, well, I don't know. I heard my coworker is positive. And so this could also help you in that area to perhaps get you prepared to say, okay, I just got exposed. I'm not having any symptoms right now, but just out of an abundance of caution, I'm going to use the other restroom, all the rest of the family members use another restroom. And so you can take precautions at home and so that you can protect yourself and your family. And so really it is a good tool. It's a cool tool that we're going to be looking forward to, hoping our community would engage, embrace, and sign up. Thank you. Let me know that you need any more to that question.
Okay, oh, sorry.
I'm to your response to your question about normalcy. I just wanted to say that this tool, like the director says, is going to help us actually decrease exposure and also decrease transmission. Because if we already know that we're exposed, then we ourselves would take the precautions to not expose other family members, friends, family. I mean, if a person was exposed, to take precautions, may not want to go to bars, may not go to restaurants, just to contain that. And so I just wanted to say it's a tool so that we can get back to containing the virus like we did from March to June. And once we contain the virus, we will go back to some normalcy as we have almost gotten back to a complete containment and some normalcy to our lives. So maybe that would be how I see this tool to help us. By the way, I just installed it while you guys were all talking about it. So it's on my phone.
Thanks, Governor. I'm sure a lot of us will be doing that as soon as this is over.
And I'm telling you, I am completely, illiterate in technology. And this was very easy I just forgot my password and then I found it. So anyway, I think it's something that we should really try and get the community totally bought in it, because I see the value of this tool very much.
And you do see it as a plan forward to reopening the island?
Absolutely, because if we start seeing this and we're decreasing the transmission and decreasing the exposure, the virus is supposed to live within like 14 to 20 days, right? 14 days is really the average that people are saying and the experts are saying. So if we just contain ourselves, if we know we've been exposed to a positive, and we contain ourselves for 14 days, we're now not a transmitter of that virus. So that's how I see it as working. And, I believe that you can save one life and decrease transmission by 200.
Okay, thank you, Governor. I'm not sure if it would be you who would answer my second question, but I'm wondering how much the app cost in terms of bringing it over to Guam, and also how it was paid for.
Probably maybe OTEC will answer that. I have no idea. I know it doesn't cost anything for the person to download the app because they didn't charge me anything. I just did it.
Yes, Governor. The cost of the app actually, there are no real direct costs in terms of what we had to pay for it. This is purely an open source code that we actually use. The government of Guam does now actually own the code. And the team of developers, which actually when we started out in March, we had about 200 developers and it grew to over 1,000. And all of them are volunteers. Literally every one of them under the PathCheck Foundation that just grew on, just because ultimately this app was needed by not only Guam, but the whole world. And as Dr. Ramesh alluded to, Guam did directly contribute to a lot of the development of this app even from a global standpoint. But in terms of the costs, we did not pay for anything at this point. And again, it's a group of passionate professionals that actually got together to figure out how we can launch an app like this. And initially it started out with the GPS side of it, and it went to the gain as we really started to understand the privacy privacy preserving nature of the app itself. And Dr. Ramesh, if you wanted to add anything to that?
Yeah, I think that's a very important point you made, Frank, which is I think the foresight that the Guam team had. PathCheck Foundation, as you know, is a spin-off from MIT, is very generously philanthropically funded. That's why we're able to support many jurisdictions. But I again want to congratulate the Guam team, because not only they participated so that we can provide this solution at zero cost to Guam, but the Guam scientists and engineers on this call have contributed to something that the rest of the world is also going to use. And as we get into the next aspect of digital pandemic response, tests, entry pass, vaccines, we hope Guam, Governor, we hope Guam will remain a partner to show that innovation path to the rest of the world.
Okay, thanks everybody.
Thank you, May. And we'll go to Oyal Nirarikla from Guam Daily Post next.
Half a day, everyone. Certainly an exciting day. I think the more we hear about the app so far, it just sounds really exciting. And Governor, I can hear the excitement in your voice. So I think that is—
Listen, the excitement in my voice is, if we can do anything to stop this virus and contain this virus, it would be a plus for our people. It's very sad and very heartening this last few days that we've had more than 5, 6 deaths. And so if we can have a tool that will help decrease this exposure and transmission, I'm all for it.
Awesome. That sounds great, Gavin. I wanted to take a second just to say kudos to Frank and the team of folks who've come together to put this app together. And it's really neat to know that Guam is at the forefront of technology and that we contributed to something, as the professor said about an app that would help probably a whole bunch of other locations and jurisdictions. So that's exciting. I did have a question for Director San Augustine. Sir, it sounds like the app gathers information based on positive cases. So will public health input any of the positive cases, or is this just individual reporting? And you said the resource assists your contact tracers. And we've had some questions from residents who are asking for some clarity, as many people have said, surprise home visits are being done for those who are tested negative, while those testing positive are not checked on daily. So can you kind of speak to that, like how this is going to help your contact tracers?
Well, in terms of how it helps, it's going to give the notification to those who were exposed. So that would give them also the opportunity, if they need to reach out to us. They may have been exposed and they may be positive, depending on distance and exposure time that they are exposed. And so they come in and we can actually arrange for a test. We've also equipped ourselves with additional staff to our 311 line just in case we do have a great amount of individuals, residents on Guam enroll, and so that we can take those incoming calls as well. In terms of some people being visited who are also negative, that's actually all part of the protocol. Whether you're negative or positive, if you are in quarantine, even at home quarantine, we are working with other agencies to do spot checks and for compliance. So if you're negative or positive, doesn't dictate whether you're not going to get a visit or not get a visit for compliance. So that's just part of our protocol. Definitely always room to improve. We've heard what you've already shared in terms of some positives are saying we haven't been called. We're continually looking at how we can re-strategize ourselves and also build on our resources so that we can reach out to those who are both positive and negative for compliance. Thank you.
Thank you, sir. And Governor, I guess you're the best person to answer this question. With this new tool in our pockets now, literally, do you have any plans to maybe reevaluate some of the businesses and providing flexibility for restaurants, for example, or even some of the retail stores? And do you anticipate any changes in the 14-day government quarantine?
Every day when I hear the results of our positive cases, and I hear that maybe it isn't 80 or 90 and it's 40 maybe or 50, it gives me hope that one day we will lift those restrictions. And as soon as I start seeing more decline in the numbers, and as soon as I start seeing less hospitalization, which can happen, it can happen, I will certainly be lifting restrictions. I don't want to keep these restrictions. I want us to work together to lift the restrictions. And so when someone said I was excited about it, this is going to really help us do that. And I see it as a individual responsibility to our community, because public health isn't going to be the ones putting in the positive. They don't know your phone number. They don't know, who has an iPhone and who has an Android. They don't know that. So it's our individual responsibility. And that's why, Vince was talking about trust in the administration, trust in the government, trust that we are all working together to fight this COVID virus, because at the end of the day, it is going to save lives and decrease those numbers. I just want to say that I do want to open those restaurants. I do want to open, a lot of stuff that's going to help us back to normal life. But I also don't want to do it without knowing with confidence that we are on our way to containing this virus. And so I see this as a tool that's going to be the barrier of transmission and the barrier of exposure. And if that happens, we will see the numbers go down. We will. We will. But again, this is a call for community unity and community purpose to try and, get our lives back to normal. Believe me, I am just as frustrated as all of us out there, but we can't let this virus defeat us. We cannot. We must not, because our whole island will just suffer. And I'm calling for everybody's support, everybody's commitment, everybody to join in this tool. Remember, it's just a tool. It's one of many, many, many things that we are doing on our island to save lives, prevent lives from being lost, and to prevent us from being a sick community, and to make sure our healthcare system is at a level that is going to take care of us in a quality way. So I'm asking you right now, you have a phone. I know everyone has a phone. They're all probably texting into this press conference. And so take your time to download it
Thank
I
you
don't
so
know
much.
what else to say. I support the application. Let's try
Thank you,
it.
ma'am. We can hear the
Thank you.
passion in your voice. We appreciate
Yeah.
it. Can I just squeeze in one last question? I don't know if it would be Vince or Frank who would answer it. At this point, do you know how many people have downloaded it? And we talk about 60% roughly. What are we talking about in terms of that percentage? What are those numbers?
You know, Oya, we literally just launched the app today, this morning. So it'd be difficult to give you that answer. It'd be impossible to get you those numbers. But we are running out of time. We do have to wrap.
Maybe
the press
we
conference. I
have a game or something and say, hey, the northern region downloaded 500, the southern region downloaded 1,000. Oh my gosh, the south is winning. We can't allow that. North people, do a contest.
There you go, Gov. Spirit of competition.
Anything to incentivize people, to make it happen.
And you know, Oya, I did want to say the Guam team and Ramesh can vouch for this, that we are extremely trying to working with all of the islands. So we want to do all of Micronesia with Dr. Thane. The Guam team has been real advocates for the underserved and for those who can't afford smart devices. So we are working on trying to do some research projects with PathCheck and MIT to try and invent some things that will overcome that, that will really be interesting to the rest of the world, So this is exciting. It could bring some industry to Guam. It could help us take care of our brothers and sisters, from our other neighboring islands. And I know you're from one of the neighboring islands, and it's made Guam your home, but I wanted to make sure we shared that with you.
Thank you, Frank. I mean, Vince, I'm sorry. But yeah, and again, kudos to you and your team. You guys have done, I think, sounds like an amazing job. And hopefully people will listen to the governor and download it right now.
Thank you. Thank you, Oya. And I was corrected. Actually, thank you, Logan Regis. He pointed out that we've had 10 plus downloads so far. So
I think I'm one of those. I think I'm counted as one of those. Can I just, before, closing, Janella, can I just say, I want to thank the MIT people and for, including us in your venture out there to help the whole world. I think it's an honor for Guam to have a partnership with MIT. MIT is a very credible, very well renowned for its science and its professionalism and its research and its contribution to society. So I think on behalf of the people of Guam, I would like to just say thank you so much for being a partner with us.
Yeah, we thank you. Thank you, Governor, thank you, Governor, for the partnership. And I think as Vince said, I think even the other neighboring Pacific island regions can use this app. If there are cruises or tourists, they can continue to use it. It doesn't have to be used only within the boundaries of Guam.
Thank you, Dr. Ramesh. Thank you, Governor. And thank you, everybody, for joining us today. We're really excited about this app. You can get more information about it on guamcovidalert.guam.gov. And again, it's available on the App Store and Google Play. We encourage everybody, please download it. It's available. Just, again, repeat it. Guam COVID Alert, it's available. Please, please, please download it. We can't emphasize that enough. That concludes our press conference for today. Thank you again. Please be safe, and we hope you enjoy the rest of your day.